Hi, my name is Dr. Richard Hilsden. On my channel, it's called Knife Skills. And just so you understand who I am a general surgeon. My subspecialty is trauma surgery. And general surgery is kind of an interesting specialty. And today we're going to do a bit of a reaction video to Dr. Glaucomflecken's latest TikTok, one of my favorite doctor TikTokers. And in fact, anybody who does anything on social media, we have to give credit to what Glaucomflecken has done. His channel is absolutely hilarious, so I encourage you to take a look at his channel if you came to my video first. But I'm a general surgeon, and he's done a video on how to ace your general surgery interview, a little bit tongue-in-cheek. So I thought we'd do a bit of a reaction video, and I can talk a few things. First thing, it's worthwhile chatting and understanding like what it is to be a general surgeon. I think that term is a tough one for us. A lot of other specialties like ear, nose, and throat or ophthalmology have a kind of very specific, I would say, area of focus. So it's easy to have a name that reflects their specialty really well. General surgery, we're very proud of the name general surgeon, but oftentimes people will ask us like, oh, are you a specialist? Like, when are you going to specialize? In reality, for most of us, we do 5 years of general surgery training after med school and then additional fellowship training. So we are very highly specialized. And as a trauma surgeon, I'm very specialized as a trauma surgeon, but I operate on so many different parts of the body that it's hard to say, well, I'm an abdominal surgeon or I'm a chest surgeon or I'm an extremity surgeon. Really finding a clear definition for what we do because our scope is so broad makes the term general surgeon, I think, applicable, and we're very proud of that term. But sometimes people really have a hard time understanding what it means to be a general surgeon. Like, it's general, you're not specialized, when that's really not the case at all. But general surgery, without a doubt, has a particular culture, right? And what I love about Dr. Glaucomflecken, his content is awesome. Really gives us a sense of what's happening in various specialties. He does it in a tongue-in-cheek way, and makes us sort of think twice about things we consider normal in our specialties. So he's doing a series right now of how to ace your interview, and finally this is a how to ace your general surgery interview, and I've been waiting for this, so we'll get going on that.
Hi, I'm here for my interview. Come on in, I need better exposure. Nurse, retractor. Oh, the last applicant didn't even offer.
So here the applicant comes in and says, I can't see what's happening. Can you help retract? And of course the medical student asks for the retractor from the nurse. So there's some truth here. We would never do an interview in the operating room, of course, but we are evaluating medical students on how they perform in the operating room. It's really important. And when a student shows initiative, like maybe asking for an appropriate instrument or showing that level of engagement, that impresses us. And that's really what we're looking for when we're trying to select an applicant. So I totally agree with what he's presenting here. It's like, yeah, fantastic. You're an applicant and you've offered to help out when you worked with us in the operating room.
Offered to retract during his interview. Well done. Oh, I'll do this all day. Tell me about yourself. I'm an only child, orphaned at age 12. Your parents died? No, I disowned them in 6th grade. Why? They were both internal medicine doctors. Oh, please accept my condolences.
So here the medical student says, I've been orphaned since I was 6, but I disowned them because my parents were internal medicine doctors. This is a really good tongue-in-cheek joke that Glaucomflecken's making. Essentially, there's always been this rivalry between internal medicine and general surgery. And, sometimes it gets a little bit intense, like, who's the better doctor, blah, blah, blah. Like, it's really a friendly sort of rivalry. Even myself on my TikTok channel, when I'm doing some jokes, I'll like tease the gastroenterologist. So obviously this is not real, but it's a great joke about, essentially how, we wouldn't want to be associated with the internal medicine. How dare we? But of course that's being a bit tongue in cheek. I'm sure the internists would say the same thing about us.
Thank you. So why surgery? Well, after completing my first 24-hour surgical call, I knew I wanted to feel exhausted for the rest of my career. What are your strengths?
All right. So this was pretty funny as well. So he basically says, what's your, why do you want to do general surgery? And he says, well, after being on call for 24 hours, I knew I want to be exhausted for the rest of my career. Our call is very demanding. And prior to call protection, doing more than 24 hours, even 36 hours of call is very common. And as a staff general surgeon, it's not unusual to do multiple days in a row on call. It can be quite demanding. And without a doubt, I would say feeling tired as part of your job is still present. Maybe we're working on improving that, but without a doubt, if you're a busy general surgeon doing what I would describe as emergency general surgery or acute care general surgery or trauma like myself, you are going to be very tired at times. And having good self-care, I would say, is critical. Knowing where your limits are, taking a break or making decisions to take a break are key skills to being a good general surgeon.
Tying one-handed knots. What are your weaknesses? Maintaining relationships with family and friends. No, I asked for a weakness. Oh, estimating blood loss.
Okay, I think this is pretty funny. So basically, he says, what are your weaknesses? And the candidate says, well, my weaknesses are, managing, my relationship with the friends and family, and the staff general surgeon's like, oh, I thought I asked for a weakness, which is pretty funny. Again, you'll find on Glaucomflecken's channel when he's talking about surgical specialties, there's oftentimes a joke about prioritizing work over family. And I will say, again, a cultural thing that's reality with being a general surgeon. We traditionally have, prioritize our work. There's a belief and a passion in our work, and sometimes that can get away with some personal life. So I do think things are changing, of course, but without a doubt, we do pride ourselves on being a demanding specialty for sure, and that culture remains. Then he asked, what's your weakness? He says, well, maybe estimating blood loss, which is actually a joke, of course. The big joke is that anesthesia should always double what the surgeon estimates, and maybe that's fair. I must say, estimating blood loss is a pretty, the literature tells us that we're not good at it. And there's actually a lot of evidence that says we're terrible at estimating blood loss. And when I dictate my notes, for example, I recognize that my estimates are probably not that accurate.
How's your temper? I don't have one. You willing to work on that? Yes, sir, of course. Your patient has an intraoperative complication. Name 5 things that anesthesia did wrong. Patient moved, bed too low, blood pressure too high, they played a song they didn't like, and they looked at me funny.
All right, so this is pretty funny. So again, a few other things. I would say this is where I disagree with maybe what the jokes he's making. We definitely, as a general surgeon, I would say the main thing that we do in our culture would be taking extreme responsibility. So this is a bit of a joke about blaming anesthesia. Obviously, he's kidding around a little bit here.
Surgical resident, what would an ideal week look like for you? Working so many hours that I fall asleep standing up and have word-finding difficulties, all while convincing myself that this is actually what it takes to be a surgeon. Where do you see yourself?
Okay, so I can definitely tell you again, sleep deprivation and this culture of, toughing through difficult situations is very much part of the traditional culture of general surgery. We're working on it. I want to put out there, I don't want people to be thrown off on choosing general surgery as a specialty. But I do remember as a medical student, when I started considering specialties, I rotated through general surgery and I thought, oh, I love this job. The opportunities to help patients are amazing, and the technical skills and the whole role. But I remember finding myself thinking, the time and the sleep demands were maybe too much for me. And so I really had my doubts as to whether I could succeed in this field, and really just playing up that feeling. And I remember feeling that way when I was a potential candidate.
Yourself in 10 years? Perpetuating a malignant culture because I've successfully convinced myself that this is what it takes to be a surgeon. Where do you see yourself in 20 years? Receiving a teaching award for my contributions to surgical education. Is surgery a job? No. It's a calling. And how do you answer that call? By yelling at it for no reason in particular. Rank to match, my dear boy. Rank to match.
All right. So I really enjoyed that. So the last little bit really talked about, two things. One, the idea that general surgery is a calling for sure. We oftentimes do feel that way. I would say I feel personally very a lot of personal satisfaction, but sometimes your identity can be tied up in your job, and that might be maybe one of the more unhealthy things. And again, you talked a little bit about perpetuating this toxic culture. I really hope that we're making improvements there. And it is sometimes funny though, because I could say that people will oftentimes win teaching awards. The people sometimes who maybe do perpetuate some of the more toxic parts of general surgery will oftentimes win teaching awards, but that is kind of a strange phenomenon. But the residents who nominate them also have these similar feelings. They believe in it. They have this passion for it, or at least this feeling that it's a critically important thing for them to do. So they'll oftentimes reinforce that behavior in the staff. It's an interesting cultural dynamic. That being said, I think we've made a lot of progress over the recent years, and we're continuing to try to improve the experience really for staff and residents alike, as far as what the experience would be as a trainee, and really trying to improve the culture of general surgery so it's much more humane and much more focused on some wellness, some self-care. Because at the end of the day, I think if you're, as a surgeon, you're in a healthy mental state, you have good boundaries with your patients, boundaries with the hospital, boundaries with your family, good relationships and support with your family, you're going to be much more successful in the career. And so we recognize there's a lot more to life and more to being an excellent clinician than endless hours in the hospital. And yet I will recognize that the demands of general surgery, without a doubt, remain. That being said, Dr. Glaucomflecken's channel is amazing. I absolutely love it. He truly is a gentleman who understands the nuances of providing healthcare and can poke some great satire at it. So I definitely encourage you to check out his TikTok, Instagram. He's got definitely Twitter and YouTube. Thanks for watching.